All right, welcome to the Unofficial NCLEX podcast. My name is Katie Kleber, and I am your host. This is episode 76, Evaluate Infection Control Precautions Implemented by Staff Members. So it's important to make sure that, you get your patient on the appropriate level of isolation and that staff is doing what they need to. So, it's one of those things you want to watch that, okay, maybe they got the call that the patient was on contact precautions. We want to make sure that was implemented. We want to make sure that was charted. And what does that being implemented look like? That means getting... hospitals kind of set these up differently, but some of the hospitals I've been at, we have like a little cart that either sits outside of the room or a little kind of caddy that hangs on the door that has gowns and gloves and wipes and then you put a sign on the door and then you educate the patient and the family and bada bing bada boom, you're done. You just got to do it. But you've got to make sure that that first important step is taken care of. Typically what happens when someone gets on isolation, they're either admitted with it, like, maybe it's a disease, maybe they got admitted with tuberculosis or something like that. But more frequently, a patient is admitted for maybe they're getting a hip replacement or they're had a stroke, and on admission, we screen them for something like MRSA or VRE, send it to the lab. A couple hours later, we get a call back. Yeah, they've got MRSA or VRE, and now we got to implement our precautions. So we want to make sure that that's done consistently. We want to make sure that hand washing compliance is optimized and everybody is washing their hands before and after, utilizing their gowns. And one of the things you'll find yourself frequently doing as a nurse is reminding physicians to put those frickin' gowns on and using the isolation stethoscopes. You should not use your normal stethoscope. You should use the stethoscope that is the disposable one. It's important to do that. Important to make sure that everyone that goes in the room, see, there's a sign that everybody can see when they walk in. It doesn't say the patient has a VRE, but it says the patient is on contact precautions. And that should be enough for the staff members to know what to put on. So that's really important. We've got to make sure trash is disposed of properly so we don't have trash just spilling out of the room. And that the staff is just consistently wearing it. That's such an important thing. And you as the nurse, since you're the one that's there all day, it kind of falls on the nurse to make sure everybody is wearing what they need to wear and should be wearing. And sorry, physicians, but you guys are the worst offenders. So it's important to make sure that you're promoting that with the family members and not just the family members, but also staff as well. Some people miss the sign, or some people just aren't thinking and just go in and start assessing or doing whatever. And it's like, hold on, you got to have a gown. It's really important, too, to do that, because if we're not consistently doing that and showing that to the patient's family, that presents kind of an incongruent message that some people can do this and some people can't. And we definitely don't want to do that. So that concludes. Sorry, guys, that was a real short one, but it's just you got to make sure that people are doing what they're supposed to do. So that concludes episode 76, Evaluate Infection Control Precautions Implemented by the Staff Members.
This has been another episode of the Unofficial NCLEX Prep Podcast. To get the massive PDF guide that goes along with this podcast, head over to nrsng.com/NCLEXprep. That's nrsng.com/NCLEXprep. That's a free download that you can take with you anywhere, and you can basically have this podcast in text format. Our goal here at nrsng.com is to give you the tools and the confidence that you need to succeed in nursing school, on the NCLEX, and in your life as a nurse. We want you to succeed, and we want you to become part of this movement of nurses that is dedicated and motivated to learning and becoming the best nurse that they can possibly be. My name is John Haas, RN/CCRN, and I'm the founder of nrsng.com, and I sincerely thank you for being here, and I'm so proud of you for taking this step in your journey. Now you know what time it is now. It's time to go out and be your best self today. Happy nursing.